So let's talk about the treatment for shin splints. Now, when I have clients come in when they have shin splints, usually, and I say this quite confidently, 90% of the time it will probably be in the lower half. Okay, now you will get some individuals and some athletes that have it in the upper half, but most of the time it will be in the lower half. Now, the first thing you need to work out is how reactive these shin splints are. So does that mean that they actually have to run for quite a while before it actually becomes quite symptomatic, or can they reproduce it quite quickly? So if they can reproduce it quite quickly, then part of what I do in terms of my treatment process is I assess and I treat as I go. So I might get my athletes up just either hopping or doing some calf raises and really isolate exactly where they feel it, and then we can basically go straight into the treatment from there. So I'll probably urge you to do that if you can, because it really gives you a great overview of really isolating the areas where we find. Okay, so let's talk a little bit about the anatomy itself in this area, because shin splints or medial tibial stress syndrome obviously affects this medial compartment here. So we have our tibia down here, okay, and if we just roll off, we're in this little pocket of muscles that are basically the deep toe flexors. Okay, so we've got our flexor hallucis, we've got our flexor dig, and then we've got tibialis posterior. So that makes up the bulk of our medial compartment there. Now, in terms of working in this area, it really depends on how much tone and tonicity that you have in your gastrosoleus as well. So we're all familiar with our gastrosoleus, okay, so that's the head of the gastro, and then down here we'll have our soleus, okay, and then obviously we've got the Achilles here as well. So it's within the border of your tibia, in this pocket here, that's where our deep toe flexors, okay. So these are the muscles that create a lot of this medial tibial stress syndrome, okay. Now, if it develops and gets really quite bad, what can happen is some of the lining of these muscles that attach onto the bone itself can start to become sore, and they can actually tear away from the bone. So that is actually quite nasty. But having said that, that's actually really quite rare. You will find shin splints will be probably come on in and around when athletes have had a layoff for a while, or they're coming back and they're stepping up a lot of their training. So obviously for Mon at the start of her season, that's when she tends to feel she gets a lot of her shin splints, and that's certainly common for most of them. Okay, so let's isolate exactly where we're going to work with these medial compartment syndromes. So as I said, we always will start probably in the lower half, because that's where they're most symptomatic. Now, the technique itself is actually quite easy. All we're doing is we're going to use this middle finger here to roll off the tibia itself, and then we'll bring the other hand over the top, okay, like so, and then we just sink down and meet the resistance of the tissue. We don't want to try and push through it, we want to meet it, okay, so that's really, really important. So as we do that, we then can run along the length of this medial compartment. Now, what I tend to do is I'll probably focus on that flexor hallucis to begin with. And the idea of just doing that is that you're not doing real long sweeps up this medial compartment, because it won't, look, trust me, it will not accept that very nicely. So we're going to be really specific. We're going to meet the tissue with the resistance and work along it and work with it. So just working along that flexor hallucis to begin with. Okay, so you'll see how I sink down, meet the resistance of the tissue, and work along it. Okay, so now at the moment for Mon, she's not too tight, and she's certainly not in that reactive phase with medial tibial stress syndrome, so that's good. But if she was reactive, then obviously we'd need to lighten our load a little bit. Okay, so we'll just trial treat the area. So what I tend to do, spend a good, say, 1 to 2 minutes just stripping through this area. So you can see how specific I am. That pressure's all right, Mon. So don't forget to ask your clients and your athletes the pressure, sensitivity. So you work through along the border of that tibia into that medial sort of compartment. And it's at that stage you can then get your client or your athlete up, get them to do some calf raises or even hopping on one leg and see if that changes the symptoms. So you're looking at just assessing, treating, assessing and treating. And there is no substitute to that. Okay, so as you work through one area, then we come up and explore the next. Now, look, I'm going to talk a little bit about the tibialis posterior because it's a really important muscle because it tends to control the foot placement, especially in runners. So if that gastrosoleus is loaded, which is what you'll find sometimes with for runners, especially in that mid part of their training, if they're upping up their workload, you'll find that that tib post can also start to get overloaded. Now, if that does, then it can change a little bit of the biomechanics of the foot itself, okay, because it obviously controls that pronation. So that's not ideal for our runners, and any little excessive overpronation in there caused by that then also can create problems for the Achilles as well, because it'll start to bring in a whipping action. Not ideal, and then that can also continue on down into that plantar fascia. Now, considering that we were talking about shin splints, Achilles tendon pain and plantar fasciitis, it's really important for each one of those conditions. So it is an absolute must for all these lower leg conditions. All right, so how do we get to there? So flexor hallucis is in this lower half. So if we come up, then we'll probably hit that flexor dig. And if we come up a little bit further from flexor dig, then we're going to be up in the tib post. So the trigger points for both of those are pretty well much right next to each other. So, but what you'll need to do is just slowly push that gastro head out of the way and then sink down onto that deep compartment in that area there. Now, it is exactly the same technique. Okay, we're sinking in, meeting the resistance and just slowly working through that tissue. So make sure you meet the resistance. Okay, don't be scared to sink in, push that gastrosoleus out of the way as well. So it's really important that you meet the resistance the right way. Now, let's talk a little bit about the trigger points. Yes, it is important that we treat these trigger points, absolutely. So what we need to do here is we need to be mindful of how we do it. So I'm obviously a big fan of saving our thumbs, so if we don't have to use our thumbs, let's not. So what we can use is actually the broad forearm, as I like to use. So if you are going to do this, once again, you need to be really mindful for how much pressure you can put into this area. So obviously if you're coming in, you're going to sink in, make it as broad as you can. You can feel that bond, yep. So you really don't have to push that hard. So it is a matter of just working your way in between that tibia, pushing the gastro out, and then sinking down into that tissue, okay? Be mindful not to put all your body weight through there, because obviously if they do, you'll start to feel them contracting through their foot, and then obviously they're going to guard against you. So as we know, the art of doing this sort of particular technique is all about sinking in and hitting the right amount of tissue and tissue pressure. Otherwise, they'll just push you out, and that's just not ideal. And I'm not a fan of no pain, no gain. It's all about working with the tissue, okay? So that's the flexor dig, and if I come up a little bit further, I can then sink into that tib post, which is about there, okay? So Mon can take a fair amount of pressure because she's had a lot of work in this medial compartment. But for someone who's new to this, be mindful that you might only get away with just resting on that tissue, okay? So the more your athletes have soft tissue work, obviously the more they'll get used to, the greater amount of pressure they can take as well. But if they're new to it, do not try and over-pressurize into this area, because unfortunately you won't. You'll probably, one, aggravate them a little bit, and two, it's not going to be an enjoyable experience. Okay, so let's just recap. We're going to do our longitudinal stripping through the lower half, which will be flexor hull. Then we'll come up, hit that flexor dig, and then we hit that tib post, okay? So let's work through the tissue, doing our longitudinal glides. Then we can stop, trigger point work. Now the final part is obviously, and you're all probably familiar with the passive release techniques. That means we're just going to take the muscle through a little bit of range of movement, okay? Just really try and open up that tissue while it's starting to stretch. Okay, so we do that for each one of these areas here. Okay, so once again we come up, flexor dig, and the same process again. So we don't need a huge amount of range of movement. Okay, just a little bit of dorsiflexion, plantar flexion. That's all we're after. Okay, come up, tib posts again. Terrific. All right, so tibia, roll off, medial compartment, obviously gastrosoleus here, so we need to move that away, sink into that tissue and really feel. Once again, spend a bit of time through those trigger points and then finish off with your passive release techniques.